फर्स्ट भुरगें जालें आनी तिका आतां स्पेसिंग करपाक जाय जाल्यार अशें आय एम जस्ट पुटिंग हायपोथेटिकली तिका एक टॅबलेट घेवपाची इच्छा आसा की शी टेक्स बट वॉट इज युअर एडवायस टू दीस बिकॉज शी इज ब्रेस्ट फिडिंग म्हणजे ती आवय भुरग्याक दूध दिता हे लक्षात घेवन वॉट विल बी युअर रिकमेंडेशन टू दिस पेशंट फॉर स्पेसिंग.
So, doctor, for such kind of women, breastfeeding women, we ask them to avoid taking combined OC pills because number one, it reduces the quality and quantity of milk. So, breastfeeding women preferably to steer away from combined OC pills. Secondly, there are chances of something known as venous thromboembolism. जे आमचे पायान बायाचे रक्ताचे शिरोन रगत घट जाऊन थ्रोम्बस जाता. So that is very common postnatally, and using combined OC pills can actually precipitate this. So for such women, a combined OC pill is not the preferred choice. There are other options. Something known as the progesterone only pill. जितून जे estrogen component असता पय combined estrogen combined oral contraceptive tablets are the estrogen part is not there. So progesterone only contraceptives can be taken safely by the woman. Other options available are the DMPA or what is available in the government sector as the Antara injection. So that injection also can be begun as earlier as 4 weeks. So this doesn't affect the quality of milk. It doesn't affect anything else, and it also offers some amount of protection against anemia to this particular women. The third option for them, of course, is something known as the implant. So yeah, the नवीन Goya government and launch केल्या by the government of India. So these initially are they were very prevalently used in countries like Nepal, countries like the USA, where a small implant, so this is what it looks like. The implant is only 4 centimeters long. Itlo waldo asta to 4 centimeters long. The implant is inserted on the inner aspect of the non-dominant arm. Upper arm akolli. So dakte oshi inserter gyon, this whole device comes. It is inserted by your gynecologist, not by anybody else. It is right now to be only inserted by the gynecologist. So this implant can be inserted as soon as she delivers.
I see.
As soon as she delivers, while she's on the labor room table or while she's breastfeeding, up to the first 5 days, up to the first 5 months, anytime the implant can be inserted. The implant is effective right now for about 3 years, which is the perfect duration for women who are planning a pregnancy.
Correct.
So this implant can be available. Right now it is launched in the government sector. Private sector, of course, it is available. 3 years. It contains only progesterone, no estrogen. So all those estrogen associated side effects are not there with the progesterone, with the implant. The fourth option available for these women is the IUCD. Now the problem with the IUCD is it can be inserted only 48 hours after she delivers. 48 hours, म्हणजे 2 दिवस झाल्यानंतर copper T नाले IUCD घालूंक शकना because it is contraindicated. ते इन्फेक्शन जावंक शकता, ती भायर सरूंक शकता, ती एक्सपेल जावंक शकता. ताका लागून IUCD घालपाक जाय तर ते फर्स्ट 48 hours घालप किंवा 6 weeks नाले 1.5 महिन्याचे नंतर घालप. So these are the options available for women who have just delivered. Postpartum is a very sensitive time. Women go through a lot. तांचे hormones सगळे, it's a challenging time. Their hormones are flowing, their emotions are high, their body has been through so much. So choosing the right contraceptive is a very, very important thing, and it's also the right time for us to make decisions, for the woman to make decisions on that, for such a vulnerable period.